Okay, so we're back. Now, before we go into treating a bradycardia, you're a nurse. You're not a tech, and you're not a doctor. So you can't just do the strip and go, oh, that's a Brady. No, you have to understand the pathophysiology behind that. Now remember, our heart rate comes from our SA node over in the right atria. And so it sets the pace of our heart, right? Pacemaker kind of thing of the heart. That being said, there are actually pretty benign reasons why a patient's heart rate might be in a Brady. You may have a patient with a heart rate less than 60, the definition of bradycardia. You may have a patient with a heart rate less than 60 because they're an athlete. Yeah, when I wasn't so fat and out of shape at 54, I used to work my ass off. And when I worked out all the time and taught aerobics, yeah, my heart rate was less than 60. And who cares, right? So you have to be careful. You can't just jump to treat. You have to understand the physiology. So the best thing you can do when a patient comes in and their heart rate is less than 60 is you have to, number one, try to figure out the cause. And then you have to also assess for symptoms. What kind of symptoms? Well, I teach my students systems, if you will, and the system of cardiology is a certain set of symptoms. So if a patient has cardiac symptoms, then you would actually consider treating. So what are cardiac symptoms? Well, I hope you're writing this down, seriously, because one of the number one cardiac symptoms is dizziness or syncope. Syncope and dizziness are different, but syncope is feeling like you could easily faint. I mean, some people have even fallen. So dizziness and syncope are two major players. And then if you add some flavor to it, you could say pallor. Your patient doesn't look all that great because remember, with the bradycardia, you're not getting great cardiac output or perfusion to the human body. And you know, perfusion, blood perfusing organs. That leads me to another cardiac symptom. Blood, B. Perfusion, P. BP, blood pressure. This patient's blood pressure will probably be low if the bradycardia is concerning. Now, you learn all this crap about high blood pressure, but you don't learn enough about low. Low BP, blood perfusing organs, especially kidneys, means that we're not getting great cardiac output. Okay, you got it. Come on now, stay with me. So what do we have so far? We've got dizziness. We've got syncope, or feeling like you could faint. We've got our patient with pallor. They just don't look good. Their color sucks. Maybe even worse, cyanosis, which would be a little weird, but you'd see that with heroin, especially blue fingertips and lips, right? Cyanosis. And then, of course, we have our low blood pressure. We could add all kinds of flavor to that. We could say shortness of breath. We could say chest pain. We should definitely say fatigued, exhausted, just kind of feeling some kind of way and not the best way. So you see, these cardiac symptoms are huge because they make us decide what to do. They kind of facilitate our decision making because unstable patients may not do well with the little atropine. They may need some transcutaneous pacing, which we're going to discuss in a minute.